Thank you so much, Carol. Thank you, Carol and Pedro, for inviting me to speak at today's symposium, of course. Um, Again, as Carol mentioned, my name is Hubert, and the title of my talk today is Pluralism and Inclusion in Conservation, Understanding Traditional Chinese Medicine, or TCM, to Improve Biodiversity Outcomes. First of all, I want to just apologize to everyone and say that my research unfortunately doesn't focus on a neglected species, which is of course the focus of our symposium today. My PhD focused on the medicinal demand for rhino horn in China, as Carol mentioned. But I think that what I'm going to be talking about today has real relevance for all species and taxa that are used medicinally. If you'd like to get in touch with me, you'll see a number of different ways on the screen for you to do that. And so with that, I'd just like to start with two quick points that'll just help frame my talk today. And I'd like to present them to you as contenders for Understatements of the year 2021. Understanding that, of course, it's still January. And so the first contender I'd like to present is that the human dimensions of conservation are complex. It's pretty obvious. But in the context of wildlife trade, we know that the reasons why people consume wildlife and wildlife products are very diverse around the world, very diverse. We know that there are roughly 5 categories of these motivations, which can be divided into functional, social, spiritual, financial, and experiential motivations. The medicinal use of wildlife products can be considered a functional motivation of wildlife consumption. The second contender for Understatement of the Year that I'd like to present is that we all want conservation to be effective. And in order to do that, I think we need policies and interventions that consider both biological and human factors, and that are appropriate for the local and cultural contexts in the places in which they're implemented. And so that brings me to the idea of pluralism and inclusion and their need in conservation. Pluralism is the practice of understanding and coexisting, especially with people who are different from ourselves or who have different values or perspectives. And in recent years, there have been growing calls for there to be broader inclusion in conservation. And that includes increasing the diversity of our scientists and practitioners in the field. It includes embracing different values and conservation approaches. And of course, to include different stakeholder groups and local communities in both decision-making and in the implementation of conservation measures. Now, at this point, I'd like to point out, of course, that empathy and understanding are not solutions to our biodiversity crises in and of themselves, but they really are necessary components of any effective conservation approach. And so what does all this mean for the medicinal use of wildlife? Traditional Chinese medicine utilizes more than 10,000 varieties of medicinal ingredients. And these are drawn from diverse taxa of plants, animals, and fungi, some of which are threatened or endangered. Some of these are well known, such as rhino horn, of course, which you'll see on the screen there, but many receive much less attention than they perhaps deserve. And so the new image on the screen now is of Yunnan gold thread, or Coptis tita, which is a flowering plant that's endemic to a small area of China, which is overcollected for consumption in TCM, and which perhaps receives less attention than rhino horn, say, but nonetheless is just as important, I would think. Demand and trade in these threatened and endangered species is a major challenge for conservation. And the legitimacy of conservation measures in the eyes of stakeholder groups, in this case, traditional Chinese medicine stakeholders, is of critical importance for effective conservation. And so this really requires conservationists to have a basic, or at least a functional understanding of traditional Chinese medicine. And so with this in mind, several co-authors and I wrote a paper last year published in the journal People and Nature entitled Understanding Traditional Chinese Medicine to Strengthen Conservation Outcomes. And the remainder of my talk will draw largely from what we've written about in this paper. Scanning the QR code on the screen now will link you directly to this paper. I can't speak for my co-authors, but my motivation for writing this paper is that at the beginning of my PhD, I found traditional Chinese medicine to be very foreign and rather unfamiliar. Even to me as someone who grew up in Hong Kong and where traditional Chinese medicine is everywhere. And so my thought process was, well, if I find traditional Chinese medicine to be quite difficult to relate to, I'm sure there are others in the conservation community who will feel the same way. And so the purpose of this paper really is to make traditional Chinese medicine more accessible to conservation scientists and practitioners, so we can begin to bridge some of these gaps. And so I want to speak a little bit about the context of traditional Chinese medicine in society and culturally. So traditional Chinese medicine is really an inextricable part of Chinese culture. It informs people's personal and collective identity, and is also really just a part of a lot of people's daily lives, down to the way they cook and the way they eat. Clinical experience in Chinese medical learning has been accumulated and documented over the years, thousands of years, and has been passed down, documented and passed down. And many of the core concepts in traditional Chinese medicine today remain largely consistent with what was established as early tenets, and which were written about in early texts, which date back 2,000 years. Today, traditional Chinese medicine is formally integrated into China's healthcare system, where it's officially practiced alongside Western medicine or biomedicine at every level of China's healthcare system, in both the public and private sectors. So, for instance, in hospitals, there are departments and wards that provide traditional Chinese medicine services, and there are even dedicated hospitals that specialize in traditional Chinese medicine services, such as the one in the image on the screen there, of a TCM hospital in Guangdong province. There's been incredible growth in the use and industrial scale of traditional Chinese medicine, both in China and globally in recent years and recent decades. In 2019, traditional Chinese medicine was recognized by the World Health Organization and included in its global diagnostic compendium. And today, TCM continues to be actively promoted by the Chinese government, both domestically and abroad as part of its foreign policy. And so I want to jump into the basic principles of TCM next. And to be fair, there's no real way for me to cover the basics of traditional Chinese medicine in a comprehensive way in 12 minutes. And so I'm going to present here in one slide the sort of bare bones basics of TCM that I think that conservationists who are working on species that are in use in traditional Chinese medicine might benefit from knowing. And so TCM in a nutshell of a nutshell. At the very core of traditional Chinese medicine is this. So this, many of you might recognize this or have seen this symbol before. This is the symbol for yin yang, which is a concept in Chinese philosophy where yin and yang are opposite yet complementary and interdependent forces of nature, which exist in everything that's in nature. And it's always about a dynamic balance and harmony between these two forces of yin and yang. From the perspective of traditional Chinese medicine, human health and well-being is all about balance and harmony, whereby balance both within your body and between the self and the external environment leads to good health. Whenever there are imbalances, that leads to illnesses and poor health. And so really, illnesses are viewed as patterns of such disharmony, whether it comes from an excess of heat or an excess of dampness or a deficiency of qi in a particular part of the body. It really is always to do when that delicate balance of health has been disrupted. And so what traditional Chinese medicine practitioners do is they help their patients restore and maintain harmony. And they do that by addressing those underlying imbalances that lead to illness. So as an example of how this differs from Western medicine, or the approach of Western medicine, coronavirus disease 2019, or COVID-19, in the eyes of, or from the perspective of Western medicine, is caused by an infection of the SARS-CoV-2 virus. From a Chinese medicine practitioner's perspective, COVID-19 is caused by an excess of dampness and heat that's caused by an external factor. And so that's really, in a nutshell of a nutshell, how Chinese medicine views health and well-being and illness, and how that sort of differs from Western medicine. Now, where traditional Chinese medicine and conservation intersect is typically at the point of pharmacotherapy. And this is where traditional Chinese medicine practitioners will prescribe decoctions for their patients to consume in order to improve their health, or to regain that balance. Medicinal ingredients are prepared and consumed. Typically, these decoctions contain multiple ingredients written out in traditional formula that are then customized for each patient and according to their condition and according to the availability of ingredients and also affordability. And each medicinal ingredient, including those that are from threatened or endangered species, has unique characteristics that target specific imbalances in specific parts of the body. And so what we really want to be doing from a conservation perspective is to move towards greater sustainability in how these ingredients are produced and used. And so I want to bring that sort of full circle back to the idea of pluralism and inclusion, which is that traditional Chinese medicine isn't fundamentally at odds with conservation. Pluralism is possible, and conservationists can be proactive in ensuring that policies and interventions are contextually appropriate. So we can consider the needs and perspectives of TCM stakeholders in policymaking to ensure that these are accepted, adhered to, and perhaps even embraced. And this includes the establishment of trade policy. We should be tailoring behavior change interventions, such as demand reduction programs, to ensure that they're culturally relevant and to ensure that we don't alienate these critical stakeholders. We can be engaging with members of the TCM community to find sustainable solutions where threatened or endangered species are used. So for instance, finding medically viable substitutes from the perspective of Chinese medicine to replace products that are derived from threatened or endangered species. And so I just want to conclude by saying that it's important to recognize the cultural significance of traditional Chinese medicine and gain a working knowledge of it. And because this will allow conservationists to find solutions that work for both traditional Chinese medicine stakeholders and also for biodiversity. And so with that, I'd like to thank my funding agency, the Li Xiaqi Foundation, for supporting my research. And thank you all for making it to the end of the presentations in this symposium.